And we know that high blood pressure or hypertension is a very common health condition in India. According to health experts, this condition affects 1 in every 4 men and 1 in every 5 women here. But hypertension is manageable if one exercises regularly, controls their diet and avoids sedentary and unhealthy lifestyle. Some of the main reasons behind hypertension in young people are stress, obesity, poor dietary habits and a sedentary lifestyle. Dr. Sanjay Gupta, Senior Consultant, Department of Internal Medicine's Paras Hospital, Gurugram in New Delhi, says prolonged hypertension also puts a person at a higher risk of several life-threatening conditions and complications like brain stroke, heart failure, kidney failure, retinal damage and others. It is critical to raise awareness about hypertension, which sometimes strikes without warning and becomes life-threatening emergency. Hypertension is a serious problem as it causes damage to vital organs. It is important that people have their blood pressure checked on a regular basis, says Gupta. Dr. Gupta further said that hypertension is a lifestyle disease, but it is manageable. By maintaining an optimal weight and eating a well-balanced diet rich in fresh fruits, vegetables, one can control their blood pressure. Junk food, spicy, oily and food rich in salt must be avoided, he says. He also says that people with blood pressure should avoid any kind of stress and should opt for yoga and meditation, which helps to reduce blood pressure. It is also important for people with hypertension to quit smoking and reduce alcohol consumption. Dr. Sanjay Mittal, Director of Clinical and Preventive Cardiology, Heart Institute, Medanta Hospital, Gurugram, said people who have an unhealthy weight, sedentary lifestyle and are exposed to unhealthy activities like excessive smoking and alcohol consumption are at more risk of hypertension. There are certain measures by which one can control their risk to hypertension. What are they? Let us see. Learn to have patience and control anger. Some people who tend to lose their patience easily are advised to follow yoga and meditation. Number 2, follow distressing activities. Stress and anxiety temporarily increase the blood pressure, which may become a long-term problem if not given due attention. People are advised to follow laughter therapy and clapping, which helps them to distract, relieve pain and stress and improve their sense of living. Next, improve sleep cycle. The unhealthy sleep routine, increased screen time, that is time spent looking at computer screens, mobile screens, etc., lead to energy consumption, which eventually makes people feel drowsy in the daytime. The lack of sleep can cause confusion, anxiety, overeating and diabetic-like conditions, which increase the risk of hypertension by 3-fold. Number 4, maintaining a healthy weight. It has been observed that fat around the belly, pear-shaped body, refers to increased insulin resistance, which further gets converted into hypertension. People should control their sugar intake and avoid sweets, sugary drinks and red meats. Number 5, stay fit and do regular exercise. There are certain myths associated with people with high blood pressure that they should avoid physical activities as it might spike their BP, which is not true. Physical activities help in controlling high blood pressure. It also helps manage the weight, strengthen the heart and lower stress level. Number 6, next is dietary approach to control high blood pressure, which in other words is known as DASH diet for hypertension. People should follow a diet rich in citrus and high fiber fruits, vegetables and low fat dairy foods. The DASH diet includes eating more than usual 3 times in various food groups, including grains, vegetables, fruits, low fat or fat free dairy products, meat, poultry and fish. Number 7, keep a check on salt intake. Excessive salt intake causes hypertension. The excessive salt makes the body hold on to water. If someone eats too much salt, the extra water in the blood causes extra pressure on the blood vessel walls, raising your blood pressure. People can consume potassium rich salt, which reduces the risk of heart disease and stroke by lowering blood pressure. Number 8, the environmental factors can significantly increase arterial blood pressure, including cold temperature, high altitude, loud noises and ambient air pollutants. It is important for people to understand the triggers and to stay at a distance from them. The last point is low fat and controlled carbohydrates intake. People tend to focus on controlling their fat intake and sometimes ignore the carb intake. Both high and low percentages of carbohydrate diets were associated with increased risk of new onset hypertension. A controlled low carb diet helps in improving insulin resistance, promoting the loss of sodium in the urine, which eventually improves the blood pressure.